Hi, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin, where you ask questions about getting into dental school, getting into residency, and life after dental school and residency, what to do. And that's the focus of today's episode. We're going to learn a little bit more about career options after school, after residency, in this series called Careers in Dentistry. And today, what we're going to be talking about is five options to private practice that you can learn and figure out which of the options could be the one that you want to take, as far as maybe not being in clinical practice all the time, but some options that you can consider that may be of some fulfillment to your career in the profession. So today we're here with Dr. Clinton, right?
Yes. Hi.
So introduce yourself.
Hi, I'm Dr. Priscilla Clinton. I graduated from Indiana University in 2016. I know, right? I did a one-year GPR program in Los Angeles, and I'm currently doing corporate dentistry right now. My goal, or something that I'm really passionate about, is increasing underrepresented minority groups in dentistry and just other healthcare professions overall. Mm-hmm. And that's something that I really want to get involved in, whether it's on a teaching aspect, nonprofit, or just, through organized dentistry in general. So I'm kind of trying to figure out how to go about doing that. And if I want to start with like younger kids, or if I want to start with kids that are already in college, I'm just trying to figure out how to get into that.
Okay, so let's talk about how I think there's 5 ways you can get into that. Number one is going where the underrepresented populations are, whether they are new practitioners or training or want to be dentists and new practitioners right at the school level, right? Mm-hmm. You could be faculty, within academia. And there's 2 ways you can do in academia. You can be in the school setting, or you can even be in the residency setting, right? I mean, you did a GPR, I did a GPR. There's a large pool of people that are coming through residency programs that still need some guidance, still need some mentorship, right? So those are the 2 ways in academia that you can start hitting those maybe underrepresented providers. With schools, right now there is a big shortage in tenured and non-tenured faculty at a lot of schools. A lot of the people that I'm sure taught you as faculty members at Indiana are probably been there 30 years, if not more.
Yeah.
Right? And guess what? If it wasn't for them probably living good lives, at some point they're going to go.
Yeah.
Whether they choose to or not. And there needs to be a fulfillment of those roles and those positions, right? Mm-hmm. So young junior faculty, so that's an area. You can volunteer in those areas. Lots of schools, because of budgets and things, they may not be able to pay you, but you can volunteer maybe a half a day at the school. And when there are some new positions that are possibly coming up, you may be one of the first people that they consider. So keep that in mind. Same thing with residency programs. You're in Chicago, correct?
Mm-hmm.
So there's some residency programs downtown Chicago, on the outskirts as well. The VA hospital, other hospitals that have general dentistry programs. You can even volunteer there if you wanted to, 1 day a week or a half a day, to kind of get into that environment, to see if that's something that you like, but also it's a good source of networking for other opportunities later on. So academia is one option. Second option is may not necessarily deal with being connected with underrepresented populations, but another non-clinical option is maybe being a sales rep for all these large, big products and manufacturing companies, right?
Okay.
Henry Schein, Patterson, Burbank Dental, Benco Dental, all these different manufacturers that have products that we buy from. You know what? They're looking for people that have more experience and more knowledge about the profession. So that's an option. as well. Being a sales rep or just being into that environment, maybe working your way up to different positions there. Another third option. The third option is maybe going into the military. Going into the military. You're looking at me like,
I don't know about that one. I thought
not with this president we got right now.
Exactly. I don't know if I trust the government enough right now.
I understand, but I will tell you, it's a great career option. A lot of people will go in, whether they received a scholarship from dental school and they're putting their time back, or like myself, I went in right after residency, did 4 years, and it was a great career option. I probably, if I had to do it again, I would do it again. But what's nice about that is that you'll become an officer in the military. You'll get some very great training, great collaboration with other dentists, which will allow for more networking for later on, right? You have the opportunity possibly to teach, whether it's at a residency program, because the military, they have residency programs as well. And guess what? You get to travel.
Which I love.
You get to travel. I know. I remember that. So that's why I put that one in there. You get to travel. I was stationed in Korea. I had a chance to also station in other parts of the U.S. that I probably would have never visited. And there's many different options to travel as well. So that's needed as well, because there are people that look like us, but there's not a lot that are actually in officer positions. A lot of us will go through that route for several years and then maybe go into the private practice sector. So that's what happens. So that is an option as well. Number four is organized dentistry.
Mm-hmm.
Organized dentistry, right? I'm sure at your school, Indiana, just like for me at Maryland, there wasn't a lot of faculty members that looked like us.
No, not maybe 3, I think.
Maybe 3. Guess what? In organized dentistry, in some of these organizations, it's less than that, right? But there needs to be someone who advocates for the underrepresented populations, for the vulnerable populations as well. So that's key. So learning how to be a part of that facet of dentistry, organized dentistry, very key. Being a member of the ADA, being a member of the NDA, being a member, if you're in education, being a member of ADEA, the American Dental Education Association, all of those organizations and much more, AGD, the Academy of General Dentistry, all those organizations are looking for leaders, looking for people to continue to push the curve and push the envelope, push the needle into subject areas like how access to care and training of more underrepresented minority providers. So that's another area, another option. And then the fifth and last option, I think, is related to your goal of being connected to and helping underrepresented populations, is actual government. Government, meaning local government. Mm-hmm. You can still be a dentist, but also be a leader and be a representative of change in your local government, whether it be, where you live. There's a colleague of ours down in Atlanta, he's a pediatric dentist, Dr. Jaha Howard, who just was successful in becoming a member of a school board in his local area. And for many people who want to get into politics or want to get into government, that's a first entry point. But why that is so important is because it deals with people, public, helping them, right? Being a voice for some of their concerns, many of which have concerns about maybe pain in their mouth or not being able to afford health care, or even afford most importantly, dental care. There's a lot of people that realize that there's, 80% or 90% of most people throughout the states realize that it's important, but they don't go, or 30 or 40% of them don't go because they can't afford it. Mm-hmm. Cost is a barrier for them. Yeah. You can be a representative on the government level and helping the local level, which maybe get expanded to your state level, which gets expanded into the national level. We've got 5 dentists that are representatives in Congress right now that are there helping to promote and activate some change within certain, legislation. So that's an option also, government, where you can really impact the underrepresented population. So I think those are the 5 areas where you can get started and maybe start thinking, and we can talk a little bit more, but I think that's a good start. What do you think?
I think that is a good start. I've been thinking a lot about the political aspects of it. And I was talking to some of the people at Run for Something, where they try to increase the more millennials who are getting into government and, making policy changes. So that's a good avenue. And then I think dental school, like being a faculty or like volunteering as a faculty would be great. I know UIC is really close to where I live. I don't know any faculty members there. Do you know any, adjunct faculty there?
I got 3 faculty members at UIC that I can get you in contact with.
I would love that. Yeah.
Yes. There's people there that have been there probably 30 years. And there's also a dean. I forget the first name. I can see his face right now. That's been there. He's one of the senior dental school administrators there at the school, who's a dentist also. Dr. Mark, I forgot his last name. I have to shoot you his information. But see, there you go. You can just, we can get you connected with him, and you can start to explore that option, because I'm sure they need you.
Well, that's good to hear. I want to be there too,
Yeah, I'm sure they need you. They could definitely use you. You could use them. And that might be a relationship that you can start to build, so that as they're kind of recruiting you for junior faculty over the years, that also brings other opportunities as well.
Okay.
Because last time I checked, they're not going to stop making dentists.
That is true. It's increasing now. Yeah, I think that'll be a great start. And I'd love to get in contact with him and any other, faculty that there.
Pendleton, Dr. Pendleton, Mark Pendleton is his name. He's like associate dean, diversity, something like that. He's like, again, he's got a senior administrative position there at UIC. I'll get you his information. I'll text it to you. But yes, let's get started. And I will tell you, you know what? Let's meet. Let's meet in Chicago. I will be there in March. The ADEA, American Dental Educational Association meeting, annual session is there, March 16th to the 19th. We've got to get up, because I'm sure Dr. Pendleton's going to be there, and there's going to be other faculty members from other schools, even from the Chicago area, Illinois area, that you can meet and start talking about, hey, I'm interested in academia. What are some options at your school? But that way you and I can meet up, and I can make those introductions to you. And there are probably going to be some product manufacturers there. I'm sure on the exhibit floor, you can kind of go around and kind of search and, maybe, get some introductions. That's another way as well. So let's meet. ADEA, it's on that Saturday. I forget what day that is. I think it's the 17th or 16th. Saturday, March 16th, there's an ADEA Go Dental Conference, where there's probably going to be about 30 to 40 dental schools there to recruit pre-dentals, but also it's a good opportunity for us to make some introductions to faculty members that are looking probably also for some junior faculty in the future.
Okay, sounds good. Sounds like a plan.
Good. If you guys think this sounds good as well, make sure you put in the comments what you liked about the video. The question of the day is, what career in dentistry are you pursuing? What career in dentistry are you pursuing? Make sure you put a note right down here. Also, check out the next video. Boom, right here. There's one here, and there's one that's going to come across right there. Check out those videos. Tell me how you like them. Hey, Dr. Clinton, thanks so much. And we'll be talking soon.
Okay, talk to you soon.
Bye.